For people who have been fully vaccinated or already had COVID-19, how worried should they be about the Delta variant?
Good question, Kyle. So let's tackle the first part of that question, which is those that have been vaccinated in terms of the Delta variant. So in comparison to those who have been vaccinated, people who have not been vaccinated have about an 8-fold increased risk of coming down with SARS-CoV-2 Delta variant. And when we talk about hospitalization, which is the big problem, of course, with the cytokine storm and the pneumonia, the risk drops 25-fold for those that have been vaccinated against those that have been not vaccinated. So there is quite a bit of a difference. Now, that's not as big as it used to be before the Delta variant, but it still holds that. And so in terms of worrying about it, I would not worry if you're vaccinated. Now, there has been a little bit of a reduction in the ability of the vaccines to prevent infection, and we're seeing more and more of that. But again, that is an 8-fold improvement over not being vaccinated. Now let's get to the second part of your question, and that is related to those that have been infected previously. Now, we did a video on this, and we went through the data that was published recently in Nature that showed that people who have had a 12-month history since their first infection with SARS-CoV-2 had reduced effectiveness of their antibodies against the Delta variant. Now, if we were not talking about the Delta variant, we would be able to say that based on the data coming out of the Cleveland Clinic, that there really is no difference between those that are vaccinated and those that have been previously infected. But the Delta variant has actually changed that, we believe, based on at least some of this data that's coming out on antibodies, albeit that antibodies aren't the end-all be-all of immunity. There's T cells and B cells. We don't have all the data yet for those that have been infected previously with COVID-19, non-Delta variant, but the data seems to indicate that there may be a reduction in the immunity of those that have had SARS-CoV-2 in the past against the Delta variant.